The way that our conventional system defines infertility is really by like age and by how long you've been trying. If you're under 35 and you have been trying the natural way for 12 months, that's when you get infertility. If you're over 35, they give you 6 months to try naturally before they give you the infertility diagnosis. I try not to be like a fear monger in talking about this, but we also have to have awareness that there are chemicals that are all around us that absolutely influence our hormones and our ability to ovulate and our egg quality.
Hi, everybody. Welcome back to another episode of She's in Sync. Today, I have a special guest, Anna Bonangle, and she is a registered dietitian. And we're going to dive into a lot of really great things that I know a lot of you are interested in talking about related to fertility. So, Anna is a fertility dietitian trained at the National Institutes of Health, who knows firsthand how frustrating it can be to be doing everything right and still not get pregnant. After restoring her period and conceiving naturally, defying doctors who said IVF was her only option, she created Fertile in 4, a root cause approach program with an 82% pregnancy success rate. Over the last decade, Anna has helped hundreds of women restore full fertility, skip unnecessary treatments, and finally bring home their happy, healthy baby. Anna, welcome to the show.
Thank you so much for having me, Taylor. I'm excited to be talking with you.
Yes, me too. I obviously gave like a brief overview of your story of doing everything right and having difficulty getting pregnant. Let's dive into that a little bit more of like what is your story? What got you to this place where you now focus on helping other women naturally conceive?
So actually how I got here, it's a pretty long-winded story and I try and keep it concise because it was really like a conversion of both my professional and my personal life. But I think maybe what's more interesting to your audience is like on the personal side when I say I was doing everything right. So, I was a dietitian already at this point. I was like 34 years old when I started trying to conceive. And, when my husband and I decided we were ready, I took out my IUD and my period didn't come back. So I was like shocked. And in retrospect, it makes sense to me, but at the time I thought it was like super healthy. Like I exercised a ton, I was into marathons and triathlons, but I also felt like I ate a ton, right? And I was certainly not like my BMI was in a healthy range. I had never been like an athlete in high school or certainly not college. I just like got into exercise as an adult. And so I knew that over exercise and under eating could have those impacts, but it never honestly occurred to me that that could be me. And, I wasn't the case where I had gone on hormonal birth control to restore my period. Before going on birth control, everything seemed normal. So it just like the whole thing was totally surprising to me. And I knew enough, like from my years as a sports dietitian, to know like if my period wasn't coming back, like this is a big red flag. This is like something wrong. But I was that case of going to get some, basic testing done with like my OB-GYN, and everybody said everything was fine. Everything was normal. And to me, that was like huge eye opener. Like, what do you mean you can't tell me everything's normal if I'm not getting a period? So that's what sort of like kickstarted my whole passion for helping women figure out what's happening with their bodies so that they can take control of their fertility journey.
So, what were some of the things that, besides just saying your labs are normal, that doctors told you? Because you mentioned in your bio, like they pretty much just said, like everything's normal, just try IVF. Is that kind of how it went?
hmm Yeah, so I was 34 when I started, but by this time I had turned 35, so I was advanced maternal age. So at that point, they basically give you 6 months to try on your own, and if it doesn't work, there's a conveyor belt, right? Of like try Clomid or Letrozole. That doesn't work, IUI. If that doesn't work, then IVF. And I like wasn't even really willing to get started down that conveyor belt because they said to me pretty quickly from the beginning, they were like, with a period, if, because we did Provera challenge, that didn't work, if nothing's going to work, you're pretty quickly going to be going on to IVF. And I just put the whole brakes on the whole thing at that point and was like, I need to figure out for myself what's going on
Yeah.
before I just jump into these treatments.
What is a Provera challenge?
Oh, so Provera Challenge it's basically like a synthetic progesterone that they give you to
Okay.
try and build up your uterine lining to see then when they withdraw it, if you'll then have basically a withdrawal bleed.
Okay, gotcha. So does it act kind of like birth control? Like where it's
Mm.
artificial
Or,
progesterone.
but it's not like a full month of it, right? Like they don't,
Okay.
there's, yeah.
Okay. Gotcha. Yeah. And I'm imagining, like, what do you see as, is that kind of, you mentioned like the conveyor belt. So is that kind of what you see in clients that come to you with fertility issues, is they've been recommended pretty much nothing else besides those things?
Totally. Yeah. They're really not presented with any other options.
Mhm.
And I just want to be really clear, like, I'm not anti-fertility treatment. There are quite a few cases that I've seen, like, it really is probably the most promising option
Yeah.
for a lot of couples, and for some, it really can be a miracle.
Yeah.
My issue, or why, I'm so passionate about this work, is because too often is presented as the only option. So, when women start trying to conceive, really all they're typically told is like, take a prenatal.
Mm.
Maybe if the doctor is like somewhat more holistic minded, they might say like, eat well, exercise. But that's about it. That's all women are given. And then when that doesn't work, it's onto that conveyor belt I was just describing.
Yeah.
Like, give you meds to force ovulation, even among women who are already ovulating. And then IUI, which really does nothing but move, the sperm closer to the goal. And then IVF, which again, it basically bypasses all of the natural processes in your body. It bypasses ovulation and transport down the fallopian tube and implantation, and tries to force all of that process rather than supporting your body and doing it naturally.
Yeah. Yeah. And we're very aligned in that too, because I oftentimes will say, like, I'm not anti-birth control, like, we're not anti-IVF or anything like that. And we have to be looking deeper of, like, did we try these things first? Is that actually a viable solution? Or is that just a band-aid that actually isn't going to work to something that's a deeper problem? So I love that you mentioned that. So, talk to us a little bit about, there are different types of fertility. And I didn't really, I mean, I kind of knew that, but I guess just because I have not, had kids yet at this point, I didn't realize the different subtypes of infertility. Can you kind of talk about the different types of infertility that you see in your practice?
Yeah. And I'll preface it by saying I really don't like to use the term infertility because it makes it sound so finalized. I
Mm,
think a more appropriate term is subfertility, meaning your body needs some extra support to get fully fertile, but that doesn't mean it's not possible for
yeah,
you.
love that.
The way that our conventional system defines infertility is really by like age and by how long you've been trying. So if you are, like I mentioned a moment ago, if you're under 35 and you have been trying the natural way for 12 months, that's when you get infertility. If you're over 35, they give you 6 months to try naturally before they give you the infertility diagnosis. And then, like you said, so there are different, causes or types of infertility. In the conventional world, the way they think about it is like there's three real big buckets or big categories. There's ovulatory infertility. So that's where the most common of which is like polycystic ovarian syndrome or PCOS, but there's some disruption to the hormones preventing regular ovulation. There's anatomical barriers. So this could be something like you have a shape to your uterus that isn't conducive to implantation, or maybe there's some inflammation or some scar tissue blocking your fallopian tubes. And then the third big bucket that we can't completely forget here is the male factor. So 35 to 40% of infertility cases are male factor, which is a huge one. But then unexplained infertility comes in, which is an estimated like 30% of cases because everything else that I didn't mention basically just gets clumped into unexplained infertility. So when I say everything else, I mean literally like if you have subclinical hypothyroid, if you have endometriosis, if there's egg quality issues, I wasn't getting a period and they couldn't figure out why. So I was unexplained infertility, right? It's just like this sort of huge catch-all term.
Okay. Yeah. Yeah. I'm thinking back to my eating disorder days where it was like the different eating disorder diagnosis of, like, if you don't fit specifically in this one category, then it's EDNOS, eating disorders, not otherwise specified, which was like that bucket of, like, we don't know where you fall. We just know that you have issues with eating. So, um, and that's interesting that they lump polycystic ovarian syndrome kind of on its own, but endometriosis is in that unexplained infertility.
I know. I
Yeah.
know.
And I know you and I talked because we see a lot of people with, or a lot of women with hypothalamic amenorrhea. So I want to touch on that specifically because I know when we were also chatting about like what we want to talk about on this podcast episode, my mind automatically went to like what labs do you run and what are supplements you recommend, and you were like, yes, we can totally talk about that. And I really would love to talk about how just basic foundational nutrition and lifestyle practices can come into play. So talk a little bit about all of that.
Yeah, in prepping for this, I listened to some of your podcast episodes and learning more about your approach. And I really am on board with the approach of like not jumping right into like really expensive, really advanced testing until you have the foundations in place. So when a gal comes to me and her, like for the very first thing that we do is look at her cycle, right? Like what can we learn from what your body is telling us? And I'm really on board with the viewing your cycle as like the fifth vital sign. What is that telling us? And if you're not getting a period at all, there's not much we can glean from like expensive advanced functional hormone testing until we get your body cycling. And that almost always, 9 times out of 10, comes down to strong foundations. So making sure you're eating enough in total, but of the key nutrients, and that those meals are blood sugar balanced, making sure that your exercise routine is appropriate for your hormone health and that it's adequately balanced with good rest and recovery. So that means really good restorative sleep. We absolutely look at the nervous system and have you just totally normalize this go, go, go constant stress lifestyle. And you may not even feel stressed, but you are like running at a higher level of fight or flight or stress response than your body wants to be able to reproduce. And then another bucket that I put in the foundations is hormone disrupting chemicals that are all around us, like in our plastics and perfume and on our food. And I try not to be like a fear monger in talking about this, but we also have to have awareness that
Yeah.
there are chemicals that are all around us that absolutely influence our hormones and our ability to ovulate and our egg quality.
Yeah. Yeah. And I see a lot of women, exactly like you said, similar presentation where we live in a perpetual, like, exercise as much as you can, like never take a rest day. I'll sleep when I'm dead, eat less carbs, more protein, like lots of things in our culture, very much first and foremost, they are not geared towards women's health. It's a very masculine energy. And I mean, it's unhealthy for men too, but it's not built around hormone balancing for women, and it's detrimental to our fertility because we need rest, we need rejuvenation, we need carbs and fats for optimal hormones. So even if you feel like you have a good healthy lifestyle, it could veer on that like it's too healthy, and that's inadvertently working against you when it comes to fertility. But doctors are asking that, and so I think that's where it's so important. I mean, I think every doctor should have a dietitian on their team that they refer to when it comes to these things, because you need really a team around this, and that's not their wheelhouse. Like the dietitian, like us, we know those types of things, we know what questions to ask, because if they're saying like, are you eating healthy, you might think you are, but it might not be optimal for fertility and for conception.
Yeah, totally. I mean, so many of the lifestyle habits that a doctor would say are totally healthy are not
Yeah.
conducive to hormone balance, right? And it's so hard because it's almost always the gals who are trying so hard. They're trying so hard to be healthy. They think they're doing everything right. Like you mentioned protein, right? Like everybody comes to me and is like, but I'm supposed to be eating lots of protein, right? Isn't that what I'm supposed to be doing for my hormone health? And while the answer is yes, it's never going to be about going to the extreme end of the spectrum, right? There always needs to be some checks and balances in the nutrition and not just eating protein with no carbs.
Yep. Yeah, I mean, a few years ago it was all about keto, which was really high fat, and now it's all about protein, protein, protein. And I don't know if it'll ever be about carbs. I feel like those will always be demonized, but there's always going to be a trend. And just like Anna said, like anything in the extreme, run the other direction, because that is not like our body needs a balance of carbs, proteins, and fat, and we need adequate calories to fuel our bodies.
And to feel safe to reproduce, right?
Yep.
If you're not getting that in and getting it in consistently, a huge piece of what I like to talk about is having those balanced meals, but having them every 3 to 4 hours, right? So that your body can trust that there's consistent fuel coming in.
Yeah. And also, there's research showing too that even if you're eating enough, but you're over exercising, that can, cause issues with hormone balance, lack of fertility, et cetera, because it's your body not feeling safe. It's if we think about pregnancy at the core, it's your body has to feel safe enough to bring a baby into the world. So if it doesn't feel like it's safe from your own body, then it's not going to, let you bring another life into the world either.
Hmm. Hmm. Yeah, I mean, to help really drive that home and help people understand, you can really think about it like your body has to prioritize. So if there's not enough fuel coming in, or if you're exercising so much that your body feels like it's in constant fight or flight, it's going to do everything it can to keep you alive, right? That's its first priority. And so that is going to mean prioritizing things like getting sugar into your bloodstream so that you can run faster, and it's going to deprioritize functions like digestion and reproduction, which is why so often things like anovulation or missing periods goes hand in hand with bloat and constipation and all kinds of digestive issues, as well as often feeling really cold or maybe hair loss, because those are the kinds of things that your body has deprioritized in its effort to keep you alive, to do what it's meant to do, to protect you.
Yep. Yeah. And I'm imagining I might know this answer, but maybe I don't. So whether it's hypothalamic amenorrhea, whether it's PCOS, I am imagining would you do the same foundational assessment with people of like regardless of if it's HA or PCOS, like we still have to be eating enough, we still have to be managing our stress. Like are there any big differences between different reasons for infertility? I mean, I know that there are some, but does it pretty much start with like most people, we need to go back to the foundations?
Yes, and so I do have like my Fertile and Four signature process, right? Which I've gotten copyrighted because it seems to be so effective at those foundations, the ones that I just described. And I'm also a big believer in like individualization and personalizing everything. So, yes, everybody needs to master the foundations, but exactly what that looks like varies by individual. And so I absolutely do think that it's important to do some testing. So, a good example of this would be like the first foundation in my Fertile and Four process is replenish. So, everything we've just been talking about, getting enough food, getting the right nutrients. But it can vary from person to person about like exactly what nutrients are needed. Just to like drill down in sort of like a nerdy example, like Escherichia is a bacteria in our gut. And I recently did some stool testing on a client who was like otherwise perfectly healthy, but we found that her Escherichia was low and her vitamin B12 was really low. And vitamin B12 is essential to everything from nerve transmission to being able to sustain a healthy pregnancy. So I guess the point there being that I don't just assume everybody's low in iron or vitamin D, right? I think that there needs to be some individualization in that. So if somebody comes to me, the first thing I do is I don't just take it at face value if they say I have HA or I have PCOS, because it's rarely HA. Most often women come to me saying the doctor said I probably have PCOS. And I'm like, well, let's take a step back. Based on what? How, because so often it'll just be like women will say my periods are irregular. So they'll say PCOS, or I'm not getting pregnant even. And the doctors will say PCOS. So once we have like a regular cycle, that's when I do find some more advanced testing, like hormone testing, can be really advantageous to see like what is driving some of the imbalances. Is there more inflammation at play, insulin resistance, adrenal dysfunction, that kind of thing.
What kind of functional testing do you do?
My like for everybody, my like Fertile and Four lab panel is going to include some blood work, which is going to look at inflammatory markers, a full thyroid panel, some other like autoimmune antibody indicators. Did I already say nutrient status? Um, what else do we look at? Like a lot of sort of the basic labs, but then looking at them through a functional or optimal lens.
Yep.
And then almost everybody gets a GI map. And then a Dutch, which is like a hormone test based on the metabolites that we see in your urine, is going to vary from person to person.
Hmm.
So with the hypothalamic amenorrhea case, which I'm bringing up because I believe that's like a huge part of your audience, We wouldn't do any of the like stool testing or Dutch testing until we get women cycling regularly. We would just start with the blood work. And then it's really a case by case basis in terms of what's needed.
Yeah.
I know you really love the HTMA, and that's actually something that I haven't incorporated into my practice for everybody. Still considering it though. I see the value.
Yeah. Yeah. Well, I think that's important too, because not every single population, like I find it really helpful for women who are coming off birth control because of the nutrient depletion. But like for your population, you might get just as much effectiveness from the nutrients that you're running in the blood work, you know? So that's why finding a provider that specializes in what you are, what your goals are, what you are looking for support on is so helpful. And I think that's, a lot of most doctors are generalists, right? So, and even those who are specialized in something, they have a different approach than what we do where we're looking at the root cause of things. So it's like, I always use the analogy of like, it's like the Porsche of healthcare when you work with Anna or
Mhm.
I, because it's very much like we're in it with you and we're like digging really, really deep versus a 7-minute doctor's appointment and, oh, your labs look fine. Like, here's IVF.
Yeah, totally. Totally. We're very invested. My initial intake is 90 minutes. We go really deep.
Yep.
Yeah.
Yep. Yeah. So compared to how long you've probably, I mean, that's probably like how long you've seen your doctor in, a couple of years, maybe.
Like
So,
that, right?
yeah. Do you ever work with like men on their fertility, or do you just work with like the women, or do you ever do like a combo package with people with that?
To be honest, I avoided it. I was like, I just want to do women's health. And then being in fertility, I just couldn't, I couldn't silo myself anymore because it really takes two to tango. And just more and more, I was seeing male factor fertility coming to play. So my like primary package is more focused on the female, but we absolutely do include semen analysis as a part of the package and making recommendations, lifestyle nutrition recommendations for the male partner. I really encourage couples to be in it together, so like everything that I'm working on the woman with, I'm like, let's include your partner. You guys are going to be sharing most of your meals together. This is the lifestyle, the culture of your household that you're creating for the family that you're growing. The more the man can be involved, the better. And I don't mean to stereotype, it's not always like heterosexual couples. I do work with homosexual couples too, but that is most commonly who comes to me. Um, what else was I gonna say? I was gonna say something else about that. Oh, and sometimes I have couples where like they both come to every single session, and I think that is so beautiful. So we can just like support them both together and in their relationship together.
Hmm.
Not to go too far off, but in the fertility world, something that we have to talk about a lot is like how to like maintain some of the joy in the baby making process and like keep the love alive in your relationship
Yeah.
because it can start to feel like work really fast.
Hmm. Yeah. I imagine that would be like so, so nice to have couples coming in together and making it like we're in this together because I know it can be like such a draining and emotionally challenging process for those going through it.
Hmm. Totally. Yeah.
You mentioned like some, gut bacteria, being high or low, and some, we talked about underfueling, malnutrition, lack of nutrients, the male's role in all of things. Um, are there any specific, like if we get like drill down a little bit more into those, are there any, if you had to name like three big ones that you tend to see most often? And we know like this is generalized, but I'm curious if there's like some root causes that you find outside of just underfueling that, stand out to you.
Yeah, good question. I mean, gut dysbiosis is really a big one. And I know that's a little bit almost cliche in our functional medicine world, but when I do a lot of stool testing on women, I find that there's a really common scenario of gals who come to me who have a history of UTIs and who have taken lots of antibiotics, and as a result, like their gut microbiome is totally wiped out. And that can cause some like pretty systemic inflammation in their gut. And that then can transport to, you know, inflammation directly in the ovaries and like affect damage the quality of the eggs. So that's a really huge one and one that I find can be a quick win. We
Yeah.
can, quick being, within a couple of months, we can see some really good progress in gut health, which
Mhm.
is definitely quick compared to the like IVF cycle where you're like waiting a couple of months just to get in to see a doctor.
Yeah. And that's going to translate too to not just fertility and pregnancy, but like feeling better. And I talk a lot about that too, is there's so much quick, like, oh, I need a gut killing protocol. I need to eradicate bad bacteria. But so many of the women I work with as well, it's their gut is like wiped from antibiotics or, just poor diet, under eating of pre and probiotics and birth control and all that kind of stuff that messes with the gut microbiome. It's not necessarily always about killing. It's about like, is your gut nourished and do you have enough gut bacteria? And that will translate into better mood, more energy, less bloating and constipation and diarrhea. So I'm sure that's like a welcome surprise too for women when they're working with you.
Yeah, absolutely. And that's one of the things that, when we're working towards getting pregnant, we have to measure the wins along the way. So things like skin clearing up or, having more energy or gut health symptoms, like gut symptoms improving, those are the kinds of wins we measure to know, like, okay, we're on our way to restoring your fertility.
Mhm. Yeah. What are other, like one or two other things that you see frequently in addition to like the gut dysbiosis or like a wiped out gut?
I mean, a huge one would have to be like sleep disruption.
Okay.
I would say so many of the women who come to me are either constantly exhausted, even if they get good sleep, or get in bed and can't fall asleep, or like waking up in the middle of the night. It's so common. And so I do a lot of work around circadian rhythm support and around like calming the nervous system and giving them tools to get better sleep. Because we know that when you're sleep deprived, that's going to, again, put stress on your system and put you into that fight or flight mode. It's
Yep.
going to throw off your hormone balance, right? Um, that seems to be, that's not one that like we don't have the research studies to say like you get better sleep, you're going to get pregnant more easily. But I do see in clinical practice a very direct correlation between getting better sleep, feeling better, and then you get pregnant.
Mhm. Yeah, that makes a lot of sense. And that's where it's like doctors aren't asking these things, right? Like
Right.
it's these are the things that do move the needle though.
Hmm. Hmm. And then let's see, where else would I see? Um, I'm trying to just pick just three, but I think something that's going to be applicable to almost all of your listeners is like honing in on their exercise routine. I would say a lot of the women who come to me are really worried about not wanting to give up exercise altogether. They feel like, and I totally understand this. I've been in this place too, like where it is the crutch of their mental health. It's like I have to exercise to be able to like relieve stress. And there is absolutely so much value in that. And so helping women get the exercise that they need to support good blood sugar balance, to support muscles, to support, cardiovascular heart health, but also balance that with the right amount of rest and like getting into the mindset and the routine of building rest into the picture.
Mhm.
It's a big thing that we work on.
Yeah, 100%. I think that's really, really helpful. And again, it sometimes goes against that hustle culture, like what's the new workout trend or it doesn't count if you don't sweat type of situation. It's like really what feels good for you and what does your body need in this moment. And that might look different. It will look different throughout your life too.
Hmm. Hmm. I mean, and we live in a culture where, like you said, hustle culture, but also with exercise, it's just drilled into us the more the better.
Mhm.
And if women are not losing weight and they feel like they're eating enough, most women it doesn't occur to them, at least the ones who come to me, that they could be over exercising.
Mhm. Yep.
But it is really one of the biggest things that I see is that women need more rest rather than more exercise.
Yeah. Hustle culture and diet culture, I think is our culture.
Right, right. And even if we know it, it's still so easy to get sucked into it and not realize that you're doing it.
Anna, is there anything else that you feel like women who are, maybe struggling in this place right now where they've been trying to get pregnant and having difficulty, they've probably been to their doctor and told, well, everything looks normal. I guess the next, thing is IVF or whatnot. What else would you share with anyone who's there?
Yeah, the biggest take home I'd love to leave your listeners with is like trust your intuition. I think so many women start to doubt themselves when, the white coat syndrome where they believe that their doctor knows best. And in so many cases, like modern medicine is a miracle. And in this instance of like fertility and women's health, if your instinct is telling you that there's something more that you're missing, something else you could be doing, that you don't actually need IVF, that your body can do this, I would say trust that instinct because so often there really is, the doctors are not giving you all of the options.
Yeah, and I talk a lot about that too of we have an amazing medical system and it's not built off of women's health and there's still so much misinformation, lack of education around that space too. So again, I'm just like likening it to the women that I work with the birth control story and the journey of like, well, we don't really know, like just go on birth control. It's like a cookie cutter medication that is
Yeah.
masking the true issue, but is, women don't really have any other option besides that other than to suffer with whatever symptom. And it sounds like women who are struggling with infertility or suboptimal fertility, I like that a lot better too. It's very quick to, we don't know, like, just do this cookie cutter IVF, which again, nothing wrong with that if that's truly what someone needs. And really, finding an expert who specializes in that, like Anna, who can unearth a lot of these deeper things, because you might just need more sleep to eat more food or more of a specific food. You might need to work on stress, like all things that we should probably be working on in general. And then if that helps you get pregnant versus having to spend so much money and time and energy doing IVF, like that's definitely worth exploring if you haven't already.
Yeah, beautifully said. And I would add that it's not just about getting pregnant naturally versus avoiding IVF. It's about getting pregnant, period, right? Because if you don't address so many of those deeper underlying issues, then IVF still doesn't work. The stats on IUI and IVF are like really abysmal. Almost two-thirds of couples have to do 6 rounds of IVF, right? So, and it's because they're bypassing looking at what's actually causing the fertility issues. So if you actually want to get pregnant more quickly and easily, we first have to address the real issue.
Well, another thing that made me think of too is like, and stay pregnant and have a healthy pregnancy. Feel your
Yeah,
best during pregnancy. Because if you have all these issues that aren't addressed, I think that's when a lot of people deal with really, and it can happen for a lot of reasons, but a challenging pregnancy or postpartum, you're setting yourself up for healthy foundations for you and your family beyond pregnancy too.
100%. Yeah, I'd like to say that all the time. You're setting yourself up for a better pregnancy, but then to thrive as a mom, right? Like you want to enter motherhood feeling good and having the energy to enjoy it. You've worked so hard to get here. Yeah.
Yeah. Well, thank you so much for sharing your wisdom and your knowledge. And I think that you have so much, not only like education and clinical experience, but you're just a very calming force. I'm sure you help so many women just in feeling more optimistic about their chances of having their dream family, which when they've tried so many other things, I'm sure just that in and of itself is so encouraging to people. So thank you for what you do.
I love it. It's the best job ever.
Yeah.
Yeah.
So to finish off, I always like to ask my listeners a fun little question at the end of how you are nourishing yourself recently.
So I have just designated September as self-compassion month for my community in like my fertility group, and I'm really trying to hold my own feet to the fire to practice what I preach and do it myself. I find like being kind and gentle with myself is kind of the hardest thing. So I've been nourishing myself by just trying to take like self-compassion breaks throughout the day where I just tell myself I'm okay and it's okay. And like, how can I just be a little bit kinder to myself in this moment?
Yeah, I love that. It's like little mini pulse checks of, where's my mind at? How can I be kinder to myself, give myself grace?
Right? Right?
Yeah,
It sounds simple, but it's hard and
so
it's a
hard.
muscle that I really think is worth building.
Yeah, I absolutely love that. I think everyone should take self-compassion breaks and breaths throughout the day. I think that would be so, so nice because think about I forget what people say, but it's like the person that you talk to the most is yourself, or I forget what the saying is, but like you're the one talking to yourself in the head the most. So how are you talking to yourself?
Yeah, I haven't heard that, but that's like so spot on.
Yeah.
Totally.
Okay. I thought I like butchered it, but yeah, it's something like that. So hopefully that resonated with people.
We get the point, and it's
Yes.
powerful.
Yes. How you talk to yourself is so, so important. All right. So thank you so much for joining us. If you liked the show, please share with a friend who might be on their fertility journey to give them some peace of mind. Know that there are other options out there. And oh, I forgot to ask, how can people find you or where should they connect with you? We'll put it in the show notes, but
Yeah, the best way is either my website, which is fertility-nutritionist.com, or on Instagram, I'm my fertility nutritionist.
awesome. And you have a like a free webinar masterclass or something too?
Oh yeah. I've got two freebies for your audience. One is like for people who really just want to get started on what does it feel like to fuel for fertility? What does like fertility eating feel like, look like? I have a 2-week ultimate fertility meal plan. It's all like my own recipes, so I know they're tasty and simple. So I'm happy to give that to your listeners for free. And then I have for those who are like maybe further along in their fertility journey, who are really wanting to understand what are some of these underlying causes that are maybe being missed by my doctors, I have a free masterclass called Four-Step Formula to Get Pregnant Naturally.
Okay,
I'll
awesome.
put
So
that
we'll
link. Use
yeah, we'll
that
put
link.
all of those in the show notes for you guys. So definitely follow her on Instagram. Check out those free resources. I'm sure they're amazing. So thank you all for listening. And until next time, stay nourished.